Welcome back. According to the World Health Organization, health ethics promotes the consideration of values in the prioritization and justification of actions by health professionals, researchers, and policymakers that may impact the health and well-being of patients, families, and communities. Now, to expand on the importance of health ethics in Namibia, we are joined on the line by the Chief Legal Officer, that's Johanna Nghishekwa, from the Health Professionals Council of Namibia. Good afternoon and welcome to the Daily Roundup.
Yes, good afternoon, and thank you for having me.
Now, to encompass this discussion, briefly talk to us about the various values and actions that health professionals abide by.
Yes, the health professions are the people in our community that have a delicate relation with the member of almost every member of the community, and they are expected to abide by high standards of rules. And one of the most important, crucial rule is rule of confidentiality, because these are the people who keep the crucial information or personal information about their patients, and such information is disclosed to them with the aim of assisting these patients with their medical conditions. So that's why they are held up to a high standard, especially when it comes to the relationship with their patients. They are expected to act in the best interest of their patients.
Now, over the years, stigma has had people not access the help that they need. And with that said, there is stigma attached to health professionals, and of course the fear that a patient's health history becomes a discussion in public rather than it being patient confidentiality. What do you have to say about this, and how does it impact the well-being of communities?
Yes, like I indicated, the relationship between a health practitioner and a patient is very delicate. And that's why they are held to keep every information that is communicated to them by a patient very confidential. It's a legal and an ethical duty that confidentiality must be kept at all times. And it also assists in a way that patients will be comfortable knowing that whatever they convey to their health practitioner is kept between the two of them. And it assists also in facilitating the treatment that a health practitioner is offering to the patient, because they know more information about the patient and nothing is withheld back. It's very important that that relationship is protected for the treatment of any condition that the patient might have.
Well, we also witness that people who are on certain medication will rather go and get their meds in a different town as opposed to the one in which they reside due to stigma. How can communities be assured that they are safe and should access health facilities as soon as they require help, as opposed to waiting for the time to reach the next town?
Yes, as the responsibility lies with the practitioner to keep the information confidential, it's also the right of the patient to know that if such information lands in another person's ear, there are remedies that are available to the patient. They can approach the court if disclosure of that information has harmed them in one way or the other, or they can also approach the Health Professions Council of Namibia to lay a complaint against that practitioner. And of course, I think it's important to also highlight that the confidentiality rule there are exceptions to that rule. Of course, those exceptions are in cases when the patient gives consent, or when there's a legal duty on a practitioner to report that information because it might have caused harm to a child, or it neglect to the child, or any treatment that is offered to that patient might have resulted from a criminal activity, or if the patient is a danger to him or herself. Only those exceptions, the disclosure can be made. Or in another instance, when there's a court order for that practitioner to disclose such information. Other than those circumstances, the information must be kept confidential during the treatment or the relationship, or even after the relationship between a doctor and patient has ended.
Equally, people choose to get tested for example, HIV in other towns due to the fear that their statuses might become public, or you would see some health professionals stream on social media their patients' consultations, or they speak of patients' experience on social media. What constitutes a correct behavior for health professionals to speak publicly, and what warrants an exception?
Yes, as a health practitioner, you are not supposed to speak publicly about your patient's health condition or health information. That is strictly prohibited, except in those circumstances that I have indicated. Not that it should be spoken publicly. It should only be spoken to the people that are involved, especially if it's a court order. You can only disclose that information to the court official or to the judge or to the magistrate. If it's in case of suspects that a child is being abused or there's a child neglect, you report to the right authorities. And it's not public information per se, even with those exceptions that the information might be disclosed. So, strictly speaking, the disclosure is not supposed to happen. And if it happens, then that practitioner or that health professional has breached his or her legal and ethical duty to keep the information of the patient confidential.
Now, I know that you touched briefly on this, but can you highlight some of the negatives that could arise when health professionals' actions are not justifiable to the work ethics that they took an oath to?
Yeah. Firstly, like you spoke of stigmatization. That if anyone knows about someone's health status, depending on what condition that person has, the person gets to be stigmatized, and it has personal and perception negative effect on that person, and also that it might lead to patients not receiving correct treatment because they withhold information from their health practitioners for fear that any information that they are going to disclose might be taken out to the third parties. And most importantly, it creates a distrust between the patient or the community at large and the health professionals. And like I've indicated, that if that delicate relationship is broken or it's not a trust relationship, then health services might not be provided to the extent that it should be provided to the patient because the information is not being disclosed.
So in closing, what are some of the measures that can be taken by the patient if they feel that their right to patient health professional confidentiality has been compromised?
Yes, like I've indicated, the patients have options. If such a disclosure has caused damage to the patient in one way or the other, the patient can approach the court and file a civil suit against that practitioner. And also at the same time, the patient can approach the Health Professions Council and file a complaint of unprofessional conduct, and it gets investigated from the professional perspective, from the ethical perspective.
Well, Ms. Nghishekwa, thank you so much for your time and for that information that you have provided.
Thank you so much.
It's Chief Legal Officer Johanna Nghishekwa. She is from the Health Professionals Council of Namibia, ending our discussion. Well, let's take another short break and we'll be back with a daily roundup.